there, I'm Molly, the nutritional therapy practitioner over at parsleyandpumpkins.com, and today we are going to review the PCOS symptom checklist. Now, if you would like a printable version of this checklist, there is a link in the description, so you can grab it there. Now, this is a full list of symptoms linked with PCOS, so you will not have all of these symptoms. And that's because PCOS is not one disease with one cause. PCOS is a set of symptoms, and PCOS can actually result from insulin resistance, adrenal dysfunction, thyroid dysfunction, extreme stress, chronic inflammation, or even coming off of the hormonal birth control pill. Now, the more items on this list that you check off, the more likely it is that you have PCOS. Your symptoms can also give you a clue about what issue might be your root cause for PCOS. So you'll need to talk with your doctor about all of these symptoms that you're experiencing, and they can run the necessary lab tests for you to confirm this diagnosis. So a quick review, the hallmark features of PCOS are increased androgens, so this is things like testosterone, DHEAS, polycystic ovaries, and irregular cycles, especially cycles where you do not ovulate. So let's look at the physical symptoms of increased androgens. This is usually something we have to do a blood test to check for, but there are many physical symptoms that can indicate this might be an issue for you. The big ones are excess hair growth on your face, your arms, back, and chest, pretty much anywhere that you don't want hair to be growing. Thinning hair on your head, also known as male pattern baldness, acne, headaches, and painful bumps under the skin, especially in areas where your skin folds, so in your armpits and in your groin area are the big ones. So let's take a look at the physical symptoms of insulin resistance. This is actually the cause for about 70% of women with PCOS. So a big one is weight gain and difficulty losing weight, and this would be weight gain that is not normal for you. So you really need to know your body and what is normal for you. Trouble sleeping is a big one, especially waking up in the middle of the night and having a hard time falling back asleep. Darkened skin, especially around your neck, is where you'll notice it the most. It might look like you wore a bad necklace that kind of rubbed off on your skin, except it doesn't go away. That can be a big sign. Skin tags is another one. Low sex drive. And then really high lab numbers like hypertension, high cholesterol, high triglycerides can all be indicators that insulin resistance might be a problem for you. So the signs of irregular periods are pretty obvious. It's things like infertility, which is characterized as trying to get pregnant for 12 consecutive months without success. Having actual irregular periods, so this would be cycles that are an abnormally long length. It could be missed periods altogether, or it could be periods where you just are not ovulating. So an easy sign is using ovulation predictor kits at home and not seeing a positive result in the middle of your cycle. And then there's a couple of other symptoms that can be from these less common causes of PCOS. Being underweight. This is a subset of women who experience PCOS due to undereating and over-exercising, putting a really chronic stress on their body. Any other kind of chronic stress, so this includes physical stress like over-exercising, as well as emotional and psychological stress. Digestive symptoms are definitely worth paying attention to. Running cold, especially having cold extremities, so hands and feet. And then recent use of hormonal birth control. So in the beginning of this video, I mentioned that recently coming off of the pill can actually be a cause of PCOS for some women. Now, if that is you, please know that it does take your body some time to recalibrate after you come off of those hormones, but this is likely a temporary condition for you. So don't stress too much. Continue to support your body in the ways that you would otherwise for PCOS, general hormonal health, and good fertility. And just be patient with your body as you go through this transition. Now, there is one huge complaint that I hear from most women with hormonal imbalances that I purposefully left off of this list. Period cramps and pelvic pain. Pain is actually not a symptom of PCOS. So the multiple cysts that are characteristic of PCOS are not the same thing as ovarian cysts, which are painful. Likewise, irregular cycles don't cause pain, and high androgens in the blood don't cause pain. So if you are having painful periods or just pelvic pain at any other time during your cycle, this is a sign for you to keep learning, keep digging, stay in touch with your body, because there is likely a different cause for your pain and it's not the PCOS. Please share this video with your friends, consider subscribing to my channel, and be sure to watch the rest of the videos in my PCOS playlist. We're going to talk all about how you can manage this condition naturally and finally find some relief. All right, I'll see you in the next video.